in a stage that celebrates beauty, strength, and confidence, one element remains timeless: the power of smile. I am Dr. Boskey Panikar, BDS and MDS. Along with me is Dr. Arjun Panikar, BDS and MDS, and also holding a fellowship in implants from France and multiple advanced certificate course in aesthetics. Together, we have been leading Smile Invent Dental Clinic since last 13 years.
Whenever we smile, if we have two white teeth, what's going to happen is when you're speaking to someone, the eyes should contact. But there is a lot of this Hollywood smile going around and a lot of over bleaching of teeth going around. So as soon as the teeth are whiter than the sclera of your eye, when you smile at somebody, they are going to look at your teeth. So we don't want that. What we want is that when you're smiling, the person is keeping contact with you in your eyes. Your smile shouldn't steal away from that. It should complement your entire face. So don't go into over bleaching or those Bollywood smiles and all, since you all are in the limelight profession. A brief input about how you can maintain your oral hygiene, okay? One thing that you can do is night brushing is the most important. Because if you don't brush at night, those 6 to 8 hours that you're sleeping, the bacteria are doing the most harm. So when you brush at night, you've eliminated bacteria, and for those 6-8 hours, it's going to be clean. Water flossing is another very important thing. Water flossing is the only thing which is now available which can flush out bacteria between your gum and teeth. So if I take a thin probe or a pin and place it between the gum and the teeth, it will go in about 2 to 3 millimeters. Now when you brush, when you use a mouthwash, that area, the bacteria is intact. You cannot flush it out. So when you use a water flosser, what it does is it's high pressure water hitting at the junction of the gum and tooth and flushing out that bacteria for bad breath and stuff. After we brush our teeth, gums, cheeks, everything, it's also very important to brush the tongue. You can use a tongue cleaner, but just using your brush is also good enough.
With respect to teeth alignments, can all types of misalignments be rectified by aligners or like invisible stuff, or there are some situations we do need the braces?
So aligners and braces, not all cases can be done by aligners. Some cases you need to go back to your normal braces work on. When it comes to final tooth movement, aligners have a little more precision in them compared to braces. But there are still some complicated tooth movements that aren't possible with aligners, and we have to go back to braces in those cases. It's been a great session interacting with all the 12 finalists of Mr. India. Tips upon how to keep their oral hygiene, tips upon how to smile, and the questions that were thrown at us were quite a few, and we enjoyed ourselves answering all those questions.
Yeah, thank you very much, Times Group and Mr. India and all the 12 contestants. It was a pleasure meeting you all. Thank you.
I just asked about how the bleaching acts on our teeth, and he explained very well. So now I know how to use bleaching and actually what's the positive and negative impacts of bleaching on our teeth.
So we just got done with our Smile Care session, and I must say it was a very necessary and well thought out session. So we got all our doubts cleared. I think all that I learned is going to be really helpful, and I'll use all these learnings in my day-to-day life going forward.